The problem is you do see a lot of antisocial people succeed. Loneliness is as big a risk factor for ill health and death.
We live inside our heads.
You go cold turkey, you go into withdrawal.
There is a lot of value in the stuff that we struggle with.
Better Thinking. Conversations with experts exploring all things psychology. Welcome back to Better Thinking. My name's Nesh Nikolic and my guest today is Ahu Kocak, speaking about working with at-risk populations in correctional settings, managing self-harm and suicide. Ahu is endorsed in forensic psychology with over 14 years experience in prison, court and private practice settings. She holds a Bachelor of Science Psychology, Master of Psychology, Graduate Certificate in Law and Master of Terrorism and Security Studies. She is a full member of the APS and a Fellow of the College of Forensic Psychologists. Outside of her experience in the assessment and treatment of high-risk offenders, Ahu often uses Schema Therapy, ACT, CBT, ABA and exposure therapy for a range of presentations in her clinical practice. Ahu has developed group programs for Schema Therapy in correctional settings and is an APRA board-approved clinical supervisor. It was a great pleasure interviewing Ahu and understanding the role of psychology in correctional settings and how biopsychosocial factors need to be considered differently to assist inmates in managing their mental health and in turn mitigate self-harm and suicidal thoughts and behaviours. Enjoy. Ahu, a big thank you for coming onto the podcast today. I'm excited to talk to you about, in particular, working with at-risk populations. I know this is a topic that not many people have had exposure to, and being a psychologist, it's something that I'm always interested and fascinated with, and in particular because looking at that vulnerable population within a correctional setting, those that are maybe prone to self-harm and suicide. It's a really unique, at-risk population. So thank you for coming on today.
Thank you for having me.
Look, I always like to start with finding out a little bit about how people have found themselves in these settings, and obviously yours is quite unique. The forensic setting and correctional setting is an interesting one to me, so maybe we can start there. How did you find yourself working in this area?
Look, I think I always knew I wanted to do something with criminal practice, criminology. I always knew I wanted to do something with the law. I was just dabbling in ideas of studying either one, doing some postgrad work with law when I first finished my undergrad. I was also at times interested in policing. And then when I came across the forensic masters, it sort of it just made sense. I was always very intrigued with the characters on policing shows or Law and Order, and the profiling type of characters without really knowing what profession they were doing. So I don't know, I was always just drawn to that area. And then when I pursued my master's in forensic psychology, I ended up doing a placement with Forensic Mental Health Services in the ACT, and part of their role was servicing the adult correctional and youth centres. And that's just how I fell into it. And then eventually I went over and started working in corrections as a senior psychologist for several years after that. And then that's sort of what I've done prior to leaving government, is just really embedded in prisons, myself into prisons.
And how often in that setting do you see self-harm as an experience, as a risk factor for people in those correctional settings that you've worked in, and also suicide? How frequently is this something that is observed? Is there data that's different across different settings? Is it fairly stable? What's your personal experience been?
Yeah, so I think one of my first experiences, even in my first year of postgrad work. So very early on, I had to deal with a death in custody. He was a young, a young adult. He had schizophrenia. And I think what intrigued me the most was he was seen by a psychiatrist and a psychologist that same day. And no one had assessed him as essentially being at risk of suicide, which he ended up doing later that evening. And I think what was most intriguing is, well, what were the factors there that were missed, or did something change in that day? Did something happen that day that was the tipping point? So that was always something that stuck with me. But in terms of numbers, suicide or self-inflicted injury is not a consistent statistic in prisons. And so what we found in the ACT was, because it's one jail, even one death a year was significantly disproportionate, because it's about the ratio, it's about the number of inmates or detainees. So for having one death in a couple of years for 350 prisoners was significant. Yeah, based on the research. You look at somewhere like New South Wales, where there's thousands and thousands, it's the expectations and the thresholds are a little different. So it was sort of clear that ACT did have an issue, but it had more of an issue with how it managed self-harm behaviours, so chronic self-harm behaviours, even if it didn't ultimately lead to death, because they are still statistically significant as well. So yeah, I came across many incidents of self-harm. In prisons, self-harm becomes a way of communicating. And that's where I think that's where some of the problems lie, because the risk of accidental death or consequential death from those self-injuries is more of a problem than suicide in itself, if you think about it. And so the climate of the prison, the management of these individuals, it starts very much from the beginning till the end. So any practice involved, a huge overhaul of how everything was happening. It's not just sort of one source or one practice or one team or one clinician. So it's a really big process. And again, coming back to the ACT, it's a small jurisdiction. It was the first time a sentenced, a prison that held sentenced offenders was open. It's mixed gender, it's mixed classification, and yeah, there was a lot of professional immaturity and not really understanding what the best practice was for that population at the time.
That's a really large number. I just did back of the envelope figures while you were talking.
Yeah.
I think in Canberra, and there's going to be some errors in this, but I think in Canberra, I heard the statistics are there's a death to suicide every 11 days. I think, if that's correct, obviously there's an assumption there. 365 days divided by 11 is 33 in a year. And that's over a population of, let's say, 420,000.
Yeah.
And so if I do the math on that, it's one in every 12,700 people, let's say, if I round it to the nearest 100, versus, as you said, 350 inmates. Is that right?
Yeah,
so it's one in 350. And let's say we do that over 2 years. That would still be 1 in 700. That is an astounding number. If we do it like,
That's right.
1-to-1. So I can appreciate how a single death is disproportionate. It's a very large number immediately because it's such a small number. Wow.
Yeah, from the outside, it might just look like, oh, well, that's it's only one every 3 or every 4 years, but you need to be considerate of the actual number of people in the population in that setting, not compared to other.
What's your sense about why that's a higher number? You mentioned that self-inflicted injury can be a form of communication in correctional settings. Maybe you can. Is there something in combination of those two? What's your sense?
Yeah, so reviewing the practices at the time, and this is still very relevant to this day, no matter how evolved and how progressed systems become, there's always room for improvement, of course. And you'll find particularly in New South Wales, for instance, every jail, although there's a statewide system, every jail will have its own climate and its own culture and its own practices, which will contribute to particular problems or challenges and contribute sometimes to deaths. So coronial inquiries obviously are very good at unpacking those, and we have a lot to learn from those findings each time. However, at the time, the things that were contributing to those statistics and continue to do so if they're still unaddressed is the overall culture of the prison. So that includes how these behaviours are managed, or how these presenting issues are managed, the number of segregation cells and the number of time, the number and length of segregation. Indigenous people obviously were quite overrepresented as risk factors. The age of the inmate population. So we know that young males are at higher risk, 15 to 49, as are elderly people. And those who are first time in custody are at higher risk. And boredom is a really big one. So the issue that was quite prevalent when we undertook our review was that people had nothing to do. So there was no industries, there was very little purposeful activity, there wasn't enough programs running, there wasn't enough contact, or what we call dynamic security, so having staff actually go and interact. So you'll find that prisons that have less dynamic security, so staff that are just sitting behind a glass wall or not actually having some type of interaction, will likely have more self-harm or suicide rates, because there is a lack of trust. There's also a lack of staff gathering information about someone's well-being, and that culture doesn't foster inmates to approach those individuals. It's also lacking intelligence. Is there something going on? So you'll find bullying, inmates feeling unsafe, court dates, so going from remand to sentence are significant risk factors, having made a previous suicide attempt, and obviously if they end up having access to alcohol or drugs. So there's plenty of layers there that need to be addressed. And then secondary to that is how are those issues responded to? What systems are in place? You'll find that most centres, particularly in the early days, were focused more on a security approach. So, putting up physical barriers, removing their clothing, removing hanging points, removing this, removing that. And that's fine in the immediate sense, but it's not fostering coping skills. It's not addressing the long-term resilience that inmate or detainee might need for the future. And so what you might see is that they're managed in the immediate sense, but then as soon as they're released from that environment and down to a less restrictive environment, that's where they may then initiate or complete their suicide. So there's a lot at play that requires good processes to work.
I can see how some of those contributors are so tricky. Some are situational in terms of when someone might have an opportunity for their case to be heard, and some expectations might be set and it might not go the preferred way.
Yes.
That's obviously going to be a time of stress and disappointment and probably sense of hopelessness and helplessness and all sorts of challenging things. I can see age, how that can factor in, and even someone being in for the first time. I mean, gosh, the the fear, the shock,
Mhm.
understanding how the culture might work, and you're probably exposed to risks that you haven't potentially experienced before. And then also, it's very interesting you talk about the lack of dynamic security. Geez, that's a tough one in terms of trying to have an environment that's safe for the administrators, so to speak, and obviously personnel security and the like. I'm not sure about the correct language, so my apologies. But there's such a need for that humanity, like the people who are trying to maintain a process, and obviously the security of the walls and such, keeping them safe, but also keeping the inmates looked after in a humane and compassionate and kind way. And the easiest way to do that is to meet them as humans,
Yes.
without barriers in front of each other.
Yes. Yeah, that's a really good point, Nesh, because I think obviously jails have their own cultures, and there's a lot of personalities involved. But certainly, like the concept of a healthy prison is about fostering good moral climates. And that's apart from mental health and counselling. So it means that the prisons need to be characterised by integrity, procedural fairness, and a genuine focus on the well-being for prisoners and their legitimate psychosocial needs within the day-to-day operations. And staff need to actually buy into that. They need to understand the benefit of that without necessarily falling into the trap of saying, well, they're just being treated too well. They're here to be, punished. And I think it's important to remember that the removal of them from society and being in this confined environment is the punishment. The people that work there, it's not their responsibility to punish people. That's already been done. It's very much a responsibility for anyone that works in those settings who is dealing with people who are essentially in custody of the state or in custody of the territory, that they come out not worse than when they've gone in, or if someone's family member has gone into jail to serve a sentence, whether that's for 2 years or 20 years, that they're kept alive, or at least, under every attempt to try and make sure that their well-being needs are met. So yeah, it is no different to how you would treat someone that comes into your clinic, or someone that you see in a drug and alcohol centre or in a hospital. It's the same duty of care, and I think that can get a bit lost when it comes to, when it comes to actually having some of those more human conversations with prisoners.
I can see how I've certainly done it in my life when I was younger. This whole concept of even someone going to jail, they're going to jail for a good reason. They deserve to be in there. We need to punish them. What do you mean they get televisions? That's just ridiculous. All this kind of nonsense, right? And I think that comes from a naive or very basic insight. When we start looking at one's psychosocial needs, the fact that you are a prisoner, the fact that you cannot leave that facility is an incredible punishment. It's a phenomenal and harsh punishment, and hence why it's I think, at least here in Australia, focusing on that, is reserved for very, very, very unique cases. Because it is so detrimental to people's well-being. And so you're right, the punishment is just being in that that setting. Talking about the incidence, the rate of whether it's self-inflicted harm or suicide, is that, in your opinion, the biggest contributor? I know the offset of, like, boredom, for example. If you can offset boredom, you may potentially therefore find purpose or some distraction from having your freedoms taken away, that you're given opportunities to socialize and actually enjoy the company of others, et cetera, et cetera. Is that where the mitigating factors all come in terms of, wellness and well-being, trying to provide inmates all the same opportunities that everyone else has for well-being and psychological health, but just in a setting where they're not actually free to leave?
Yeah.
Is that somewhat of what we're trying to do to mitigate some of those higher risk factors that we're seeing?
Yeah, certainly it is. It's one of the main things, I think. Obviously, there's other things at play like mental illness and access to adequate services. So in Australia, even though not every jail is necessarily human rights compliant, but they're still bound by human rights principles. And what that essentially says is that prisoners have to have the same or equal amount of access to what they would in the community when it comes to various things. So even segregation is seen as something that has to be well justified, if that makes like segregation away from not obviously the outside world, but within the prison environment, that they need to have a minimum number of minimum number of hours outside of cell. They need to have contact with other people, although that can also be, so even just hearing or talking to someone is considered, but they technically, it needs to be accounted for when those things don't happen. And so, all these things definitely come into play, but accessing services is very important. And people that are in jail should not be deprived of health services that they would otherwise get in the community, because then that's sort of, it's fundamental to their human rights. And that includes both primary health and tertiary mental health and other types of therapeutic services, whether that's in-house or, resourced from the outside, or at least they have an opportunity to source that if they wish. And so all those things make a difference, but essentially it can be something as simple as also having very good reception screening processes, or good processes every time there's a significant milestone. So whether that's in their court, going from remand to sentencing, whether there's a death in the family, and that requires, again, a lot of good information sharing. So people working at reception that know these things then need to pass that on to the counselling or mental health services who are going to follow up. People who are listening to phone calls that may hear that someone's child has been taken away or removed through care and protection can then pass that on so that there can be some monitoring or follow-up. So it's really like a whole village, it's a whole system, a whole village that needs to be working well together and exchanging information well and trusting each other, so that these things can be acted on to the best of the abilities of everyone.
The really, really good point in terms of that really speaks that how involved, how engaged is the team with the inmates, and being able to care for them appropriately depending on what's going on. And that also includes what's going on outside of the prison, because they still, like all human beings, they worry. They are concerned. They still grieve about changes that occur outside, because they don't want certain things to happen for their children, their spouses, their loved ones, parents and the like.
Of course.
What is the minimum number of hours that is I don't know, the guide or legislated or whatever it might be?
1 hour.
1 hour. 1 hour.
Yeah.
No.
Yeah.
Is that real?
That's the minimum. And that includes just having their re-yard open too. So I don't know if you've ever been to jails, but some cells, particularly single cells, will have like a re-yard and a courtyard, particularly segregation cells. So for some particularly high secure prisons, they have a lot of those types of cells, which means if they're out just in their courtyard, not out mingling, that counts as out of cell hours in some jurisdictions, for the most part. But it's I'm pretty sure the national requirement, unless it is 1 hour, minimum 1 hour cell. So if you can justify that that's happened, then that's okay. But in reality, if you think of it from a human perspective, I mean, it's.
I'm shocked.
It is. It's shocking. It's and if you think of lock-ins, right? So there's days, particularly with, during COVID, this was a big problem in New South Wales. They were getting locked in for days, sometimes weeks, and it was like, well, what can you do? So you can imagine someone sitting in a cell, no access to the outside world, everything shut down, no sunlight, very little to do. For days on end. So in that instance, what's really the only thing that's going to help mitigate any risk is contact with staff, is some level of monitoring, or at least observation, and knowing those prisoners well too. So knowing their level of resilience, knowing do they have a lot of support? Do they have spiritual protective factors? Like really understanding who we're dealing with. And I think traditional methods has been to not do that, right? But that's changing. And with every death in custody, there's been great teachings, which is a bittersweet type of outcome. But it certainly has taught Australia and the world a lot of what not to do.
And those the minimum hour being 1, how often is that exceeded? Is that I know that's a minimum, but in Australia, do we have 4 hours usually, or are we at 1 hour because that's just the functionally easiest way and the most cost effective? Like what are we actually expecting? I come obviously from completely naive. What usually does happen? I'm sure it probably changes from each facility.
It does, it does
dramatically. But from the ones that you've worked in and know of, what is it usually?
So in minimum or medium security based settings. And every jail will be different. So in the ACT, there's much longer unlock hours. As far as I can remember, I think it was from 8 a.m. till 6 p.m. for the most part. And so the issues with timeout then is really for those that are in segregation cells or suicide self-harm cells, because they're the ones, and that's part of the issue that we found is, people were put on sort of suicide watch because they were deemed a suicide risk, but they were sitting in a cell all day, every day with no out because there was this concern for their safety. So it was actually it was feeding into the risk long term. And it was, it was very important that we broke that pattern and said, well, no, they need to spend time out. They need to go out. It's not about isolating them. So it depends on the settings. For the most part, most prisons, as long as it's considered, not a high-risk security area, will encourage time out because, to be honest, the more you lock in prisoners, the more issues you're going to have. And so it's actually more work in the long term because they get frustrated. They will become quite vocal, and so allowing them to actually go out, interact, work, or do what they need to do actually is in the long term more reasonable for staff. So it's unlikely that will not happen unless there's some significant security issues going on or there's a shortage of staff. But in Australia, I think it's managed relatively well, but there are pockets, whether that be within accommodation areas within jails, or if there's high security prisons, have a significant problem with maintaining a lot of those out of cell hours because of the risk that those inmates may pose.
Mm.
So yeah, it becomes a bit of a conflict.
Yeah, wow. And uh, how does a psychologist in that setting get involved? Are these open opportunities for inmates to engage? Is there a social sort of welfare type scenario where you are asked to attend, to engage? Are there more informal ways to engage? How does it usually look on the inside, so to speak?
Well, again, every jurisdiction or prison will have their own processes, but for the most part, there's always primary health, so that's always a given, right? So there's GPs, there's nurses, they might do medication administration, they have contact. So they're what we would call frontline staff, along with correctional officers. They would have day-to-day contact, right, and like mandated contact, if you will, like, they dispense medication or they do rounds, and that's a really good source of referral or gathering information. And then most processes will involve a tertiary mental health team that may be coming in or are based at the prison. Corrections in most jurisdictions will have their own psychology team. And they focus on assessments, they focus on criminogenic interventions, not so much, and some psychological interventions too. So yeah, there's different processes. Referrals can come in from correctional officers, from health staff, and in some practices it may involve case management staff or psychologists actually approaching particular areas and just being present, particularly if there's been a death in custody, an overdose, or something that may require a little bit of what we call, health check, or a moral health check. So everywhere has their own practices. Some are much better resourced. For example, New South Wales and Victoria are very progressive in their roles with psychology and what they do. Smaller jurisdictions, I think, lack that, particularly because of expertise and resources to be able to have particular processes. But there is always a health service available, as well as case management staff that would at least be able to monitor and have mandated interactions that the prisoner would be willing to do quite easily, and then the psychological stuff might come behind that.
I can see some pros and cons in the model in that in regular life you can see your GP and they might identify something, and they may even say, hey, I can give you a referral to a psychologist. And then you can take that referral and you can chuck it straight in the bin.
Yes.
You can not act on it. No one can be, none the wiser. And so when you're in an environment where there are more controls, those things are likely to, not be lost. And that's a communication. And so the follow-up can be far superior in that correctional setting.
Correct.
On the other side, in the outside world, so to speak, you've got lots of loved ones, friends, family who can be kind of monitoring all the time.
Yeah.
And so, that early intervention, not just of monitoring and you need to see someone, monitoring and I'm there available for you,
Yes.
and how can I help and the like, which creates so much mental well-being and health and, buoyancy and the like, would be, in theory at least, much greater opportunities, and you could be quite selective, a lot more selective, with who you might kind of reach out to versus, in prison, more limited opportunities and more limited people. I mean, if we're kind of saying 300 and something inmates at a given time, that doesn't mean that you are getting along with 300 and something. You've got a small pocket and less monitoring going on. It's interesting that in some ways it feels, at least on face value, superior, But in other ones, quite challenging. It requires a lot of communication and monitoring to really get to know inmates and being able to therefore hopefully address needs as they come or anticipate needs
Correct.
potentially.
Yes. There's so many challenges compared, to the outside. Like, not, they're voluntary, but are they all the time voluntary? Sometimes they're there because they think they need to be, and you need to break through those barriers. Sometimes, they have to see you because they've said, that they're going to do something to themselves, and it's like they don't really want to engage. So your primary thing as a clinician is just trying to break down that barrier and that wall. That can take time, and sometimes it is about the need seeking and being able to get everyone on board to help with the problem solving rather than reinforce the behavior, or not actually engage with what the problem is at hand. And certainly, so for example, I know in some New South Wales prisons, for example, you'll have maybe one or two psychologists for 500 inmates. That's the average. In some higher secure areas, it might be more psychologists for a lower ratio, but that's for a mainstream prison, that's standard. And if you think already that, like, not everyone gels with every psychologist, they don't have any other option, then you need to think about the culturally appropriate, culturally informed, aspects of care. They're highly, highly reduced in prison settings. If they don't speak English, or English is minimal, or there's, they have cultural and spiritual needs. I mean, where are you going to source all of that in one pool of staff? So it can be quite challenging, and I dare say, that a lot of needs do go unmet for some people.
Well, that is the punishment.
Like
that's the punishment that we can often forget. That the fact that you are in prison means that all of these needs, there's an infinite number of needs that you just don't have access to.
Yes.
We can kind of say there's the basic ones. We'll give you some primary health, because we'll have someone, on deck, or, some nursing and the like, but all of the other important things. Where do you get your sense of adventure? Gone.
No, it's gone.
Or if you need it and you're desperate for it, I could see myself just run amok. Let's create some havoc. Let's do something that's interesting. Let's get our heart rates up. We're just bored, agitate someone, start teasing someone, annoy someone. Let's do something.
Protests. Protests come out of boredom and frustration. Yeah.
And the psychologist in me says, "Yeah, good on you."
I know, I've had to deal with a few protests, and they'll just say, "I don't care. Like, I'm bored. I don't care. I've got nothing to lose.
Yeah.
It's just something to do." Like, it's honestly no big deal. Especially if they're already at the highest end of restrictions. They're like, "Well, what can you take away from me now?" So
that's hard. And what have you found has been most useful in engaging with inmates? Because this is a very different type of population, and as you say, this isn't always voluntary. Sometimes in theory it is, but it's not necessarily either. But what have you found has been some takeaways or learnings in terms of engaging with these high risk populations, particularly when someone, there's a concern around self-harm or suicide?
Yeah. Look, I think for me, and anyone that I've supervised or managed, I try really hard to encourage practitioners just to be genuine. This is really important in those settings, because when prisoners are dealing with so many different people, you can imagine that they are not always getting consistent messages. And a lot of the narrative is that they've been let down, and it may not be intentional. People say they're going to do things, and then the next day they're sick, or they're put on another shift, or it was a lockdown. So I think being very consistent and genuine, and if you're committing to doing something, try your best to do it. If you say, okay, tomorrow I'm going to bring you a crossword, you try your best to bring it. And if you can't, for whatever reason, be honest about that. Just say, look, this happened, I wasn't able to do it, or some issues came up. So it's really just putting them in a position of being human, actually. And they'll say that. They'll say, you treated me like another human. And that's what they remember. And particularly when they're high risk, the resorting of quite restrictive measures can be quite humiliating for some inmates, particularly the removal of their clothes. And so just working with them very quickly to try and get their dignity back, staying true to your word where you can, and just giving them as much information as possible, because you can imagine, Nesh, even in normal practice, I dare say, like, one of the main things that bring people to therapy is anxiety. And what's anxiety? It's this perceived lack of control. So you can imagine what that's like in a prison setting and what you're dealing with, this whole sense of losing control. And so the smallest thing becomes so valuable. A deck of cards, something to do, a phone call that you said you're going to give, something to read. Oh, they took my pen, because that's the only thing they can control, their clothing, the way their cell's organized. So just giving them that opportunity to feel, to regain some type of autonomy over their lives, and knowing that, they have an ally in you in that. Definitely not, I think people need to be careful. It's not about condoning, bad behavior or poor behavior or enabling. At the end of the day, you're dealing with a person's experience, a person's emotional distress. It's no different to what you would in the community. You're dealing with a very valid sense of feelings, whether that's injustice or loneliness, and that's what you need to address. You don't need to get caught up in the politics of why they're in jail and who did what and what the judge said. I mean, that's not our role. Our role is to deal with the person. Yeah.
I really like that about, focusing on whether it's from a clinical mind frame or administrative, it doesn't actually matter. Of being honest, being consistent, genuine, talking about one's limitations or what you may or may not be able to do, but even mitigating things like, I'm giving you my word that I'll do something. However, should I be sick, or should I be called to another shift, or should something happen in my personal life that means I can't come in, that will most likely not occur. But I can give you my word. I'm going to put it on your file, or I'm going to note it down so that at some point
I'm going to try. Yeah.
And that there's also consistency of saying, I know your word is your word. It will happen. So, should I not see you in 5 days, I know something's happened, but the deck of cards will come because you're trustworthy. Your word is your word. And I think that goes a long way when everything else has been taken away.
Yes.
And I can imagine, also because of, the human mind, it does remember things in interesting ways where, and we get it obviously in therapy all the time when a client says, oh, Nesh, I did that thing you said last time. You're like, oh no.
Yeah.
We'll talk about something, but there wasn't an instruction at the end of that,
I had just one today where he was like, you were meant to send me something. And I was like, oh, I forgot. Sorry, you should, please next time remind me. I was like, no, that's okay. But, had I, made up some excuse or said, no, I didn't say that, and I don't know you an explanation, it just changes the whole dynamic. And if you think about one of the biggest barriers in prison is, being mistrust of authority or those that they see in authority. Well, those interactions, people might see it as a weakness, but those interactions are actually nurturing and fostering for future times when you need that person to open up. You're going to need that person to really be transparent in what's going on, whether it's about themselves or something they might know about someone else. Because that's the best way you can get information. My cellmate said something like, they don't want to be here tomorrow. They're giving away their belongings. So those relationships are very, very important in institutions like that. It allows, like I said, it opens up dynamic security, and it allows you, when the time is right, to come in and resolve problems with the least amount of harm. I've assisted with helping inmates come down off a roof, or stopping them from self-harm, and that reduces the use of force, that reduces injury, to staff first, as well. So everyone benefits from having those relationships, really.
It also establishes how you're going to be treated in the harshest of times and the most difficult times.
Yes.
Leaving little things about, whether we are defensive on a position, whether we're being accused of something, fairly or not, by being able to take responsibility, it diffuses the situation. I mean, this is a core tenet of the Gottman method.
Yes.
Take responsibility of the parts that you can own, and that tends to be understood from the other person as that they've been heard, which then allows that conversation, to be more vulnerable,
Right.
which is so important. So fascinating. Where I am mindful of time, sadly. Where can people find out more about working with high-risk populations, around suicidality, self-harm, assessment within that environment, prevention, maybe even working in a forensic setting? Where can listeners find out more if they wanted to continue this conversation?
Certainly. So, everyone can check out our website. It's www.ktppsychology.com.au to find out a bit more about some of the work that we've undertaken. They can reach out for, we always are more than happy to provide clinical supervision. Particularly, we do some supervision for staff that manage these types of wellbeing needs in correctional settings. We also, you can also check out our LinkedIn, or my LinkedIn page as well. I'm often, handing out some tips on surviving in prisons. But in time, hopefully we'll have a lot more workshops and webinars that we're currently working on for people to sign up and have some more professional development. So just, people can keep an eye out on that and follow us on our LinkedIn pages, which is Koch Thompson Partners. And I think some other information that's really valuable is obviously the World Health Organization has some really good recommendations in terms of managing suicide risk in prisons. The APS Forensic College also has some pretty good articles, and they also do a fair bit of training in relation to correctional practice and working in correctional settings. That's the two on the top of my head.
No, fantastic. And before I let you go, what are your hopes and genuine beliefs about where you see well-being moving in our correctional facilities, the improvements that you've seen, what you think is going to come about, and let's not even worry about timeframes. I think it's important to try and think about. I mean, obviously, we want everything to happen instantly, but we can get bogged down with how will that occur. But I think there is a tendency that we're doing things better and better in psychology, and that organizations are being a little bit more interested to hear what a psychologist might say about how we could do these things, whether procedural or like. What's your vision for the future, or hope for the future?
Oh, look, I think, encouraging, funding, understanding the role of psychology, not just in forensic practice, but particularly in correctional practice, like I said, I think smaller jurisdictions need to be a little bit more cognizant of the value of having more psychology positions and enabling them autonomy with decision making. Look, there's the likes in New South Wales, I'm not sure, but in Victoria, psychologists end up managing prisons. There were several psychologists in the time I was doing some reviews that ended up becoming general managers. So
Wow.
To be able to be recognised, and equally New South Wales, high-level executive positions are held by psychologists and mostly female psychologists. So it really talks to that idea that, as psychologists, we're not just about treating people who are having mental health issues or challenges. It's about the fact that we understand human behaviour, and that's within systems, that's within processes, that's within dynamics, whether that's in a family or a group. And that also is equally important when how we understand how organizations work and organizational health. So there's a lot of value in that, and not just clinically but also operationally. There's been some fantastic work done with psychologists who take on those types of positions, and I think it should continue to be encouraged and should continue to be funded. I think Australia is definitely progressing well. Deaths in custody are a very big deal, and I think our legal system has enabled that to be the case with, the level of accountability that comes out and the level of inquiry that pursues, and allowing families to get some answers as well. So, they inform us to a great degree. And I think as long as those legal checks are there, then, the correctional centres are bound to have to take those recommendations on board and continue evolving. So I think there's been a huge shift from 20 to 30 years ago in understanding the role of non-uniform support staff, and that will continue.
Oh, that's a really beautiful way, I think, to end this as well, in terms of thinking about a psychology-informed correctional setting, that we have more of a voice about what the needs are, and how they can be met, whether it's at the time of an event, whether it's preemptive, about how do we do monitoring, and how do we meet the individual needs along with, a organizational need. These are complex things, and they have different cultures, and to have a psychologist informing these, sounds like an absolutely exceptional idea. Not because I'm biased, and I am biased, and I imagine likewise, if I can say so for yourself, but I think for good reason. We're just saying let's have a seat at the table, because we can improve this. So it's a beautiful way to end this, and thank you so much for your time and your insights, especially ending in that way. I think it's a real hopeful way to think about how I'd like to think we're progressing forward, and obviously some early signs that you're speaking about are occurring in that way. So absolute pleasure to have you on the show today, and thank you again for your insights and for what you do as well. It's great to have people like yourself looking after those vulnerable, even in correctional settings, because they sadly are being sometimes neglected, if I can fairly say that, at least some of those needs, and that's hard. So thank you for your work as well.
Thank you, Nesh.